As summer gets closer, CBS This Morning co-host Norah O'Donnell is opening up about her battle with melanoma. It all started during a routine checkup right before Thanksgiving when she was 43. Out of nowhere, she found out she had melanoma in situ. She was in the middle of holiday shopping when the news hit, and she remembers bursting into tears, completely shocked. "I just couldn't wrap my head around it," she wrote. Even though she always took care of herself, she regretted putting off her checkup. Now she's using her experience to spread the word about skin cancer and how crucial early detection is. She always stayed on top of her yearly skin checks and had last seen her dermatologist, Dr. Elizabeth Hale, 2 years earlier. Back then, everything was fine. But when she finally went in again, her doctor spotted 2 areas on her back that needed a closer look. The samples were sent for a biopsy, and she was told she'd hear back after Thanksgiving. She was with her family in Washington, D.C. for the holiday when an urgent email from Dr. Hale popped up. She said the biopsy results were in, and she needed to talk to me immediately, O'Donnell recalls. That's when she learned she had melanoma on her upper left back. "I just thought, oh my God." But the doctor reassured her, "It's 100% curable. The good news is we caught it early, but we need to remove it with a significant incision. It'll be deep and we'll have to stitch it up." They were aggressive about it, making a big cut to ensure the cancer hadn't spread. By early January, O'Donnell went in for the procedure. "They stitched me up in 3 layers, about 20 stitches in total. It was a pretty big cut, but the best part? The margins were clear," she says. Still, the experience was terrifying. "It was the first time something medically serious had happened to me, and it really shook me. The diagnosis took an emotional toll too. It was a huge wake-up call. My husband was really worried, and my kids were scared. My 9-year-old son even asked me, 'Could you die from this surgery?' And I had to reassure him over and over, 'No, no, no.' On top of that, not being able to work out for 6 weeks was tough. I was miserable. It made me realize how much exercise affects my mental health. The diagnosis already had me down, and then not being able to move like I normally do made it even worse. After everything, she started digging into the causes of her type of melanoma. A lot of it comes from UVA rays and tanning beds, she says. I grew up in San Antonio, Texas. I ran track, cheered, and yes, I went to tanning salons. Back then, there was no such thing as spray tans. Now I never leave the house without SPF 50 or 70, and I stick to self-tanners. But when I was 20, that just wasn't an option. Since her diagnosis, she's become a huge advocate for regular skin checks. Most people don't think of it as a priority. We put off preventive care, she says, adding that melanoma cases are rising. Catching it early is everything. Now, I have to go every 4 months. On my last visit, they removed 2 more spots, including one under my scar. Thankfully, they were both benign, but I'm under close watch. Norah O'Donnell is courageously sharing her personal experience with melanoma in the hope that it will inspire others to take skin cancer seriously. She emphasizes that a simple checkup could make all the difference when it comes to catching this deadly disease early and saving lives. In November, Norah O'Donnell, anchor of CBS This Morning, received life-changing news when she learned she had melanoma. It was discovered after her doctor noticed 2 suspicious moles on her upper left back and decided to send them for a biopsy. O'Donnell admitted that she was at a high risk for melanoma, given her fair skin, frequent sun exposure, and past visits to tanning salons. "I was really upset and I cried about it," she shared in an interview with Inside Edition. Fortunately, with the support of her family, many of whom are doctors, she was able to process the news and come to terms with it. Her family's medical background provided her with valuable insight during this difficult time. While melanoma accounts for only about 1% of all skin cancers, it is the deadliest form of skin cancer, according to the American Cancer Society. The Melanoma Research Alliance and the CDC have reported that the use of tanning beds significantly increases the risk of developing melanoma, raising it by as much as 75%. Despite the initial shock of her diagnosis, O'Donnell is now cancer-free, having had the moles removed within 2 months of the discovery. To help raise awareness about the importance of early detection, she shared her experience in the June issue of Good Housekeeping, urging others to be proactive about their health. Don't be afraid to see your dermatologist, she advises. Catching it early made all the difference. But what exactly is melanoma? It's considered the most dangerous form of skin cancer. The term melanoma derives from melanin, the pigment responsible for giving skin its color. This aggressive cancer grows quickly and can spread to other organs, making early detection crucial. While most melanomas appear black or brown, they can also manifest in other colors like pink, red, purple, or even a skin tone that blends in with the surrounding area. Around 30% of melanomas begin in existing moles, but the remaining cases develop in otherwise healthy-looking skin. This is why it's so important to regularly check your skin, as most melanomas don't originate in moles. Understanding your risk is essential because melanoma grows rapidly, and delays in seeking treatment can significantly impact the outcome. However, when detected early, the survival rate for melanoma is nearly 100%. Early detection and treatment are key to successful outcomes, and it's critical to spot melanoma before it has the chance to spread deeply. While melanoma accounts for only a small percentage of all skin cancers, it is responsible for the majority of skin cancer-related deaths. It is also one of the most common cancers in people under 30, particularly among young women. The number of melanoma cases has surged over the past few decades, largely due to increased exposure to ultraviolet UV rays, whether from the sun or tanning beds. O'Donnell's willingness to share her story serves as a powerful reminder of the importance of skin checks and the critical role they play in catching skin cancer early. By speaking out about her personal battle with melanoma, O'Donnell hopes to encourage others to take preventive action, stay vigilant about their health, and never underestimate the impact that a simple visit to the dermatologist could have on their future well-being. Melanoma can develop anywhere on your body, even in your eyes or internal organs. Men are more likely to get it on their trunks, particularly the upper back, while women tend to develop it on their legs. Sun exposure, especially sunburns in youth, is considered one of the biggest risk factors for melanoma. In fact, UV rays are responsible for about 86% of melanoma cases. UV radiation damages the DNA in your skin cells, which can lead to cancerous growth if the damage causes cells to multiply uncontrollably. Tanning beds also contribute to this risk and are classified as cancer-causing by the World Health Organization. In the U.S., tanning bed use is linked to over 6,000 melanoma cases each year. If you have a suspicious mole or spot, your doctor may remove it and send it for a biopsy to check for melanoma cells. If the biopsy comes back positive, the next step is staging, which determines if the melanoma has spread. Once melanoma is diagnosed, it's classified based on factors like how deeply it's spread and how it looks under a microscope. The thickness of a tumor is a key factor in predicting how things will go when it comes to melanoma. Norah O'Donnell, CBS News anchor, learned this firsthand, and it all started one unsuspecting morning. In an interview with Healthline, O'Donnell shared her personal experience with melanoma and highlighted the importance of preventative care. As the anchor and managing editor of CBS Evening News, O'Donnell has been delivering crucial medical and political coverage throughout the COVID-19 pandemic and the 2020 election cycle. More than 4 years have passed since she received an urgent call from her dermatologist while shopping for sheets and towels at a department store. When her doctor told her she had melanoma and needed surgery as soon as possible, she was struck with a sense of dread. Since then, O'Donnell has made a habit of getting checked for skin cancer every 4 to 6 months, but she worries that others might not be as diligent. She's concerned that due to the ongoing pandemic, many people are falling behind on their preventive doctor visits. While some may feel nervous about going to medical settings due to physical distancing guidelines, O'Donnell points out that it might be safer than they think. One of my own doctors actually said that a hospital is one of the safest places to be right now because they have universal masks and glove wearing, O'Donnell recalled. She hopes that sharing her story will encourage others to take charge of their health, even during challenging times. O'Donnell reflected on how her experience with melanoma has shifted her perspective on cancer. While her doctor caught it early, and the surgery wasn't as extensive as other types of skin cancer surgeries, O'Donnell now has a more personal understanding of the uncertainty cancer brings. She describes the scar on her back as a reminder that regular checkups can save lives, and said her kids helped her apply lotion to it while it was healing. Now, when she tells them to put on sunscreen, they truly understand why it's so important. Her own brush with mortality has also made her more empathetic and emotional, especially when it comes to health stories. Since her diagnosis, O'Donnell has used her platform to raise awareness about the dangers of tanning and sun exposure. She has a drawer full of sunscreen by her front door, and her kids know better than to come home with a sunburned face or neck. After learning more about melanoma, she was particularly shocked by the risks of indoor tanning beds, which can increase the risk by 20%. O'Donnell recalled her teenage years in San Antonio, Texas, when she and her friends were obsessed with getting a tan. "We were definitely vain, like teenagers can be," she said, "but it's time to let go of vanity and start caring about saving your life." When O'Donnell first shared her melanoma journey in 2017, she heard from many people who said her story inspired them to get screened. Some even reached out to thank her after their screenings led to early detection of skin cancer. "That was the payoff in sharing my story," she said. During the pandemic, O'Donnell has seen news media take on a public health role, providing updates on COVID-19, the virus's transmission, and vaccine development. She hopes to continue this trend by expanding the focus to other health issues, such as melanoma. Over the past year, there's been a heightened sense of awareness about things like a cough or a runny nose, O'Donnell said. "I hope that we can extend that awareness to our overall health as well." In February, she mentioned how it was the first week without major political events like elections or impeachments, so she was finally able to take a breather and schedule a few doctor's appointments. "It's tough balancing work, family, and healthcare appointments," O'Donnell admitted. "But my long-term goal as a reporter and a mom is to change how people approach their personal health." "Visiting a doctor isn't just for when you're feeling unwell," Norah O'Donnell passionately stated. "We should be visiting doctors regularly, even when we're healthy, to prevent getting sick." She believes strongly in the importance of proactive healthcare, advocating for routine checkups like skin cancer screenings, mammograms, pap smears, and mental health visits. With the world beginning to recover and return to a sense of normalcy following widespread COVID-19 vaccinations, O'Donnell hopes more people will take the initiative to visit their doctors and dermatologists for these crucial preventive checkups. Her message is clear. Catching conditions early can save lives, and she emphasizes this over and over because she knows firsthand the impact that early detection can have. So, after going through the difficult experience of battling melanoma, what is Norah O'Donnell up to these days? She began her career as a staff writer for Roll Call, where she covered Congress before spending 12 years at NBC News. At NBC, O'Donnell took on various significant roles, such as White House correspondent, commentator for The Today Show, and anchor for both Weekend Today and MSNBC Live. She was also a regular pundit on The Chris Matthews Show and filled in as host on Hardball when Chris Matthews was unavailable. When she made the switch to CBS, O'Donnell became an integral part of the network's lineup of top-rated shows. In October 2011, she stepped in as the anchor for CBS Evening News while Scott Pelley was away. She was named Chief White House Correspondent in 2011 and 2012 and became a co-anchor of CBS This Morning in 2012. By 2019, O'Donnell reached an even higher milestone, being named the anchor and managing editor of CBS Evening News. In addition to her role as the anchor, she also serves as CBS's lead anchor for political events and contributes to 60 Minutes. She made history as only the third woman to anchor CBS Evening News, following in the footsteps of Connie Chung and Katie Couric. In April 2022, O'Donnell extended her contract with CBS News, ensuring her role as the anchor of CBS Evening News through the 2024 election cycle and beyond. The following month, she traveled to Vatican City for a landmark interview with Pope Francis for 60 Minutes. The conversation stirred headlines when the Pope touched on controversial topics such as surrogacy, gay marriage, and the role of female priests. In July 2024, O'Donnell made a major announcement. After the 2024 U.S. presidential election, she would step down from her position as anchor of CBS Evening News and transition into a senior correspondent role at CBS News. Outside of her career, O'Donnell enjoys a fulfilling personal life. She divides her time between Washington, D.C. and New York City's Upper West Side with her husband, Jeff Tracy, a restaurateur who owns the popular DC restaurant Chef Jeff's. The couple, who met while attending Georgetown University, married in 2001 and are the proud parents of 3 children. Their twins, Grace and Henry, were born on May 20, 2007, and their youngest daughter, Riley Nora Tracy, arrived on July 5, 2008. Riley's name holds special meaning, as it was suggested by the late Tim Russert, who tragically passed away just 3 weeks before her birth. In addition to their family life, O'Donnell and Tracy co-authored a cookbook for parents, Baby Love Healthy, Easy, Delicious Meals for Your Baby and Toddler, which was released in August 2010. Through both her professional and personal achievements, O'Donnell continues to inspire those around her with her dedication to health advocacy, her family, and her remarkable career. Norah O'Donnell's battle with melanoma is not just a personal health struggle, but also a powerful testimony to the importance of early detection and preventive care. Diagnosed with melanoma in situ in the fall of 2016, O'Donnell's cancer was still contained to the epidermis, meaning it hadn't spread deeper into her skin or to other organs. However, the diagnosis was a wake-up call, as she quickly underwent surgery to remove a 3-inch section of skin from her upper left back. Her experience underscores the critical role of regular checkups, especially for those at higher risk like herself. Having fair skin, spending significant time in the sun, and using tanning beds in her youth all contributed to her high risk of developing melanoma. Since then, O'Donnell has made it a priority to have regular skin checkups every 3 to 4 months and to undergo multiple biopsies, emphasizing the importance of skincare routines, including sunscreen, to prevent further skin cancer risks. Her advocacy has been vital, particularly for women, urging them to prioritize skincare and to take preventive measures seriously. O'Donnell's willingness to publicly share her melanoma diagnosis, especially in an emotional segment on CBS This Morning in 2017, has made a significant impact. She wants her story to inspire others to take action before it's too late. She frequently speaks about her experience to raise awareness about skin cancer. And in doing so, she has helped many understand how early detection can make all the difference. Beyond her health advocacy, O'Donnell has built an impressive career, winning multiple awards, including the Emmy for Outstanding Investigative Report in 2018 for her exposé on sexual assault at the Air Force Academy. She also won the Sigma Delta Chi Award for breaking news coverage for her story DC in Crisis after 9/11, showcasing her journalistic talent and dedication. O'Donnell has earned recognition not only for her work, but also for her commitment to health advocacy. Named one of Washington's 100 Most Powerful Women by Washingtonian Magazine and honored by Irish American Magazine, O'Donnell has become a role model for resilience in both her career and her personal life. Her commitment to raising awareness about melanoma and the significance of skin cancer prevention continues to have a lasting impact. Her transparency about her own struggle has sparked a wave of people seeking regular screenings, some of whom have found early-stage skin cancers thanks to her bravery. As she continues to inspire others, O'Donnell balances her demanding career with family life, further demonstrating the power of resilience. Her encounter with melanoma has undoubtedly changed how she views her health, and she has used it to fuel her advocacy, making her not just an influential journalist, but also a passionate health advocate.